Dr. Darien joins us again now, and this is a question that a lot of people have had. How do I know the difference between a hernia and a strained muscle? This one's from Jessica M.
Such a great question. We talked about it a little bit after DeMarco did one Pilates class and needed to call the ambulance.
So thought I had a hernia,
and
right?
thought he had a hernia. So a strain is just a strained muscle. A strain is just a strained muscle. That's something that you often get after exercises. Sometimes you go too hard. But let's talk more about a hernia. It's something that you normally can feel. So what is a hernia? This is a conversation that I have probably once or twice a week with patients. So just to understand, we'll talk about abdominal hernias, the most common kind. In your abdomen, you have your organs, and surrounding those organs is a fascia or a lining. And sometimes there can be small tears in that lining, or small holes can enlarge, and then our organs or tissue like that pushes through, and that can cause pain, discomfort, and a swelling that you can feel, and we label that as a hernia. Now, what increases the risk of a hernia? Anything that increases strain on your abdomen. For example, certain exercise, even coughing, or just heavy lifting. These are some signs that you might have that protrusion. If you feel a lot of pain, patients often come into the emergency room.
So can you do stretches to correct it, or possible surgery?
Surgery is usually the answer, the definitive answer and the curative answer for a hernia. I'll say most people who live with hernias are not having pain, and if that's the case, it's completely okay. The most common hernia that we all probably know about are umbilical hernias. It's what makes people have outy belly buttons versus any belly buttons. If it's not causing you any distress, then you have a cute belly button. You just leave it alone.
So how do you prevent the pain from a hernia?
And that's a key part. How do you prevent the pain? You want to decrease the strain on your abdomen. So if you know you have a hernia and you can feel that protrusion, especially after your heavy lifting, you want to make sure that you're decreasing the activities that involve the abdominal core when you're basically straining. Then you want to decrease that. Also, some patients can put binders, for example, over their abdomen when they're doing heavy lifting to decrease the risk of that hernia coming out or pushing out. If it comes out, you feel significant swelling, or if you have associated nausea, vomiting, these are signs that that hernia is an emergency and needs emergent treatment, and that's when patients come into the ER.
Always good to stretch before you work out.
Always good to stretch. And then certain core exercises, to be honest with you, can help benefit you. So for example, doing planks, tighten that abdominal wall. It can help to keep those organs and that tissue in so that you can feel stronger and feel better when you're trying to do certain things.
Yeah, with good form, DeMarco.
With good form. Good form. She's the expert over here. Thank you. We appreciate it. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.